Sometimes patients need cardiac clearance, especially those patients who are on blood thinners such as Xarelto, Eliquis, Plavix, or others. Typically, once you decide to pursue a penile implant, we can get you on the surgical schedule. Once you're scheduled, our facility will work with insurance companies to determine the amount of coverage that you will have from the insurance company itself and any out-of-pocket costs that you may incur. You will need a ride to and from surgery. Sometimes we'll have you stay in a care hotel next door, and other times we may even keep you in the hospital for one night. But in the vast majority of cases, this will be an outpatient procedure where you will need a ride to and from the hospital on the same day of surgery, and you will not be allowed to drive yourself. You should keep your body generally clean in the days leading up to the procedure. I don't have any specific antibiotics for you to take or wash that you need to do, but if you're interested, you can certainly buy chlorhexidine wash or something similar over the counter and use it in the 3 or 4 days prior to surgery. In terms of medications that you should change or stop, we definitely want you to be off of blood thinners. Antiplatelet drugs such as Plavix or aspirin need to be stopped at least 7 days prior to surgery. Blood thinners such as Eliquis or Xarelto need to be stopped at least 3 days prior to surgery. If you regularly shave, it's okay to keep shaving yourself. If you don't typically shave, that's okay. We will shave you the day of surgery, and we will take care of all of this for you in the operating room while you're asleep. You need to stop eating and drinking at midnight prior to surgery. You should pack a change of clothes and leave valuables at home. You should also bring with you a driver to bring you to and from the hospital for your surgery. As an overview for surgery, you will come to the hospital the day of surgery. You'll check in at the front, and you do need to have a driver bring you to and from the hospital. That driver can wait during the surgery in the waiting area. You'll be taken to the preoperative area where you will have IVs placed. You'll be asked to change clothes and a variety of other things to prepare you for surgery. You will need to arrive to the hospital 2 to 3 hours prior to surgery. Once you're ready in pre-op, I will typically come to your bedside, discuss the procedure with you, and sign consent forms. The anesthesia team will also meet you and do similar. We will take you to the operating room and place you under general anesthesia. The procedure itself takes anywhere from 45 minutes to 2 hours typically, but there are outliers. A catheter will be placed at the beginning of the procedure, and you will keep that catheter for one night, and you can remove it yourself at home the next day. You'll have an incision on the underside of the penis, and you'll typically have an incision in the lower abdomen as well. Once we finish with the surgery, we will put a dressing over both incisions and over the penis. You'll go to the post-operative recovery area, and you'll recover for a while there before being released from the hospital. Your driver then can take you back home, and you can rest for the remainder of the day, and you will have arranged follow-up. If you have any questions prior to surgery, you're welcome to contact my team.